So the most common question is
Yeah.
IVF painful?
Yes, that's the most common question we
Yeah.
hear. As soon as we say you need IVF, that is the first question couples ask us. Okay, so to reassure, the IVF is not a painful process.
Okay.
So basically, when we look at the different steps, the first step is ovarian stimulation. Here, it is not painful. The injections which we give are very, very, using thin needles we do. People are usually, the public are very commonly, they know what is called insulin injections. So the injections we use are also like that. It comes as a pen with a very, very small needle. So these are not painful. It goes under the skin. You don't even feel like an ant bite. It's even less than the pain, if you can relate to. But some of the women have more number of eggs, like women with polycystic ovaries. For them, they can feel a little bit heaviness in the tummy when we are stimulating. But apart from that, it's not painful, the stimulation process. Yeah. The only process which is painful in IVF is the egg collection, because we have to pass a needle into the ovary and collect the eggs. For this process, we give a light anesthetic. Okay. So when they get up or get out of the anesthetic, there is no pain, because we just pass the needle, right? We have not done cut, stitches, nothing. So there is no pain when they get out or come out of the anesthetic. Even if they feel some discomfort, it usually settles in a few hours. And the third procedure in IVF is called embryo transfer, where we have to put the cultured embryos back, right? So that is a very simple process. There is no anesthesia for that. We load the embryos in a small, narrow plastic tube and it goes inside the uterus. So, as we have seen the different processes, IVF is not a painful process. So, we usually reassure the couples when they come that it is not painful. It is just a myth that IVF, is very painful. It's very complicated. It's very, very simple.